much for joining us today. It's a pleasure to have you on the show.
Well, I appreciate you having me.
Great. Well, I want to learn a little bit about you and your background, so
Sure.
let's share that with our viewers.
Well, I'm from the Midwest, although many can't discern my accent difference from the local area. I went to Indiana University. I'm an exercise physiologist by trade. I have a director's degree, which people don't know what that is, but it's a long story. But basically, it's a PhD minus the research project.
Gotcha.
So I spent a lot of time in school.
Yeah, that is a long time in school.
Now, 12 years of post-public education.
Wow. Wow. Well, when did you join Novant Health?
April of 2011.
2011. Wow.
So I've working on almost to 8 years here.
Yeah. Well, tell me what your role is at Novant Health.
I'm ranked as a clinical exercise physiologist. I work in the cardiac rehabilitation program as the exercise physiologist in the program. So we're an ongoing behavior modification program for those people suffering from heart disease. And that's what I do. I work with those patients down there on a daily basis.
Yeah, I bet that's a hard job.
Well, hard in some ways. Behavior modification is always getting people, change in people are things that are kind of like oil and water. It's a really difficult thing to get people to make those changes. And some are more willing than others. Sometimes they're a little shocked with how much they may have to change. But most of the patients that come to us at least are willing to listen. So,
And they want to get better.
They do want to get better.
Yeah.
They are tired of not feeling good.
Well, I hear that you have a wonderful cardiac rehabilitation program. So tell me how that program works. How do you get started in it? How do they find you? Do you have to have a doctor's referral?
Right. It's going to initiate from a doctor's referral. So it's kind of a rough entrance criteria. You have to have some version of heart disease. And for most people, this is going to emerge because of complaints that they're having that they share with their doctors, and then resulting tests, and ends up getting it onto and there's a classic set of symptoms and problems that would show up on either with what the patient experiencing or what the test results are that come to some form of a heart disease diagnosis, and then the doctors will order that patient into our program. So frequently we get the name initially from New Hanover Regional Healthcare Medical Center because the patients have either undergone some sort of procedure there. And so the program there will forward those names out because they tend to farm out to the local communities, people who go there for the surgeries and the procedures. And then we'll contact a physician's doctor to sign their order form so that they can get into the program.
So when I think of cardiac rehabilitation, I think of folks who have had a heart attack, but they may not have always had a heart attack. Is that correct?
No. Actually, in our case right now, most of the patients haven't. They don't really want to get to the stage of the heart attack because that's when it's...
So this kind of would prevent that if they...
We're kind of hoping that. We really encourage patients not to delay warning signs that they might be getting because a lot of times there will be many warning signs, and if they wait too long, they can't actually get to a point where they have the heart attack. We'd rather them go see their physician before that stage so the physician can perform the necessary tests to confirm that it is heart disease, and they can have the intervention prior to having a heart attack.
Well, I'm glad you brought that up because it is Heart Month. It's February, and it's Heart Month. So I'd like to talk about the heart or disease prevention. Okay. So can you share a few of the top tips that you recommend?
Exercise as the exercise physiologist. That's what I'm always trying to promote. We try to get people to exercise daily if we can. We'll take 4 or 5 days a week. Now our program is 3 days a week, but early on, as long as they're not having any problems, we'll try to encourage them to start picking up a day or two outside of the program. But exercise on a regular basis, and they can start off with a simple walking program. We do try to encourage that it progresses. It doesn't stay at the casual any longer than it has to. But so exercising, and of course we're going to try to encourage healthier eating. And many people have heard a lot of information from a variety of sources on healthy eating that they really have a fairly good idea of what is among the healthier things to pick from. So, and then a third area is we try to encourage people to deal with stress management issues, because we do live in kind of a complicated culture. So
Yeah,
if
we
they
do.
can kind of learn to weather things a little differently, and that's so that there's try to keep the stress loads down as much as possible. So those are the three main areas we kind of try to promote some changes in.
How about smoking?
Smoking is a no-no. It is still the number one lending cause. It's preventable to the heart disease. So, and there really isn't any such thing as a safe cigarette. Given the number of people who actually have problems with dying to smoking-related reasons that don't smoke, it's a matter of how much a person can tolerate. So we just really encourage zero nicotine use.
Quickly, if I have a symptom, how do I know whether I should go to the emergency department or call my doctor?
Well, if you're having things like, say you're gardening and you're hoeing a row to get the weeds out, and you start to feel some ache, say in the mid-back, it doesn't have to be there, there's a number of places it could show up, but it goes away when you stop. But every time you go back to this, it's happening again. So this is something that you would want to talk to your doctor about. If you're at home and you suddenly have that classic heart sign where you feel like there's this crushing pressure on your chest, and especially if you're getting like sweaty or something, this is more of a crisis thing. That would be more of an emergency call. So if you feel like it's an emergency, you don't want to go to your doctor, because your doctor wants you to go to the emergency room first.
Yeah, right.
So if it's just kind of a mild thing that's kind of coming and going, but it seems to be progressing, then it's like what would be a complaint that might cause you to schedule to see your doctor.
Right.
So it doesn't feel like it's a crisis situation. Then you can start that conversation with the doctor.
And when in doubt, go to the emergency room.
When in doubt. I mean, it might be acid reflux, because that's how it feels. And if they treat it for that and you're good, that's a lot simpler than waiting it out and finding out that, it was a heart attack and you've blown out half your left ventricle.
Yeah. Well, all good information. Thank you so much for spending time with us today. I've learned a lot, and I think we need to have you back, because I have a lot more questions.
Okay, very good.
Great. Thanks so much.
You're welcome.